We'd like to carry on now into the next item. It's being presented by myself as the work of the last summer student. Her name is Anna Apara. And to keep everything even, we've had 2 students from Wales, 2 from England, 3 from England, 1 from Scotland now, and 1 from Ireland. So during lockdown year, we've done more remote work, more remote projects with the students, but it's all been terribly interesting and terribly helpful. Anna Apara is a BSc Med student at the University of St Andrews in Scotland, so Prince William's University. And she spent the summer helping me update our older pamphlets, information pamphlets for the patients. The first one is regarding pregnancy in Marfan syndrome. And certainly the care is improving all the time. But it's always best, of course, if you know you have Marfan syndrome before you start the pregnancy. There are then 2 main considerations. One is the maternal outcome, and the other one is the genetic outcome, because there is a 50-50 chance of having a child with Marfan syndrome if either parent is affected. Usually, the child is affected to roughly the same extent as the parent. However, 1 in 10 can be more severely affected, so this has to be thought about quite seriously. From the surgical point of view, preventive surgery can be offered if the aortic root measurement is expanding actively, or measures, usually we say above 4. And up to a maximum of 4.5. At 4.5, it really should be replaced prior to pregnancy to make sure that the mother is safe. Every trimester or every 3 months, an echocardiogram should be performed, and 3 and 6 months after delivery, because the wall is still weak and it takes a good 6 months to a year to get back to normal after the baby is delivered. So again, it's important to leave enough time between pregnancies for the aorta to recover. And we've already discussed pre-implantation genetic diagnosis or prenatal diagnosis if the parents are interested in planning an unaffected child. Our second pamphlet was on the gastrointestinal system. It's becoming increasingly obvious that the gastrointestinal system is affected in Marfan syndrome, and this makes sense because the elastic in the bowel wall is also thinner than normal. And so 40% of patients in our experience do have GI symptoms, usually including bloating and constipation and abdominal pain that's unexplained. Treatment is available, and it includes bulking agents, anti-secretory medicines, and laxatives. It's best to be referred to a gastroenterologist for screening, especially for allergy to cow's milk, as illustrated here, and cow's milk products, and gluten, mainly wheat-containing products. Dietitian advice is also helpful to avoid any other foods which trigger overactivity of the gut. Feet, we get a lot of questions about feet. And the 2 main problems are that the feet can be flat, which causes stretching of the tendons on the bottom of the foot. This can be very painful. It's called plantar fasciitis. And pain in the forefoot, called metatarsalgia. How do we treat these? You can't get anywhere without your feet. You can start with the shoes and try and stabilize the foot with heel cups. Stabilize the ankle with an ankle brace. Buy lace-up shoes, especially for your children, with deep toes so that there's room for the arch support that's been made especially for them. Surgery can be offered for straightening toes or fusing ankles if this is the main problem. Occasionally, a tight Achilles tendon can become inflamed or actually rupture with exercise. And for this, we offer heel supports, stretching exercises, ultrasound therapy to reduce inflammation, tendon support, and finally surgery if a rare rupture actually occurs. Psychological aspects have been beautifully covered by Dr. Berger. We've done our own survey, which shows that sleep disturbances, depression, anxiety, and pain-related suffering, especially in later years, can cause problems. We have advanced very much with the NHS in that every major hospital in the UK has a pain clinic with an amazing group of medicines and treatments available. So don't just put up with it, ask to be referred. Mental health resources are also available through the Marfan Trust. We offer a helpline by telephone and by email. We're setting up peer-to-peer support and are looking for volunteers. And we have information available on all the social media channels. The initial contact is with our helpline manager, Victoria Hilton, whom you all have met today. She can send out pamphlets. I'm happy to refer to specialists or obtain specialist opinions from the advisory committee, such as Mr. Noordine. For referral to an NHS specialist, we must go through the patient's GP. So we send literature and a brief letter explaining the need. We can also on occasion write support letters for important occasions, such as obtaining disability benefit and badges, special equipment, and for students, special consideration for increased time in writing exams or obtaining university accommodation on site for at least the first year of university. Mortgages, travel insurance, and adoption all require letters indicating that the life expectancy on average now in Marfan syndrome is in the normal range. That's what these agencies want to hear. So you can find us at the addresses and phone numbers at the bottom of this page if you want help from the Marfan Trust. I'd like to hand back now to Victoria, who is our helpline manager, and she's going to tell you, give you an analysis of her activities in the past year during COVID.
Well, when we merged with the Marfan Association in December 2019 and discussed our combined future approach, one thing dominated, and that was the need for support. That became our new emphasis. And then support was further emphasized during lockdown, when our helpline became a lifeline for many, with calls increasing exponentially. We've received over 300 inquiries since Gurpreet and I joined the Trust in March last year, a momentous month. And that's triple the number of previous years. Of those 300 calls received, one theme is increasingly dominant, and that is those questioning whether they have Marfan syndrome. Next slide, please, Maggie, thank you. A fifth of callers suspect themselves, or it has been suggested perhaps by an optician, a physiotherapist, or a GP that they may have Marfan syndrome, and they come to our charity seeking clarity and advice on the means of obtaining a definitive diagnosis, and also asking as to the ramifications of the condition, because it's something that they've never heard of before. This is happening more and more, which means we're expanding our community of supporters. By Dr. Charles' calculations, there are 18,000 people living with Marfan syndrome in the United Kingdom, and with 3,000 known to the charity, there are 15,000 unknown to us, some of whom are living unknowingly and life-threateningly with the condition. We've made concerted efforts and campaigns to spread the word of Marfan to find, as we call them, the missing 15,000. And with more and more people coming to us for diagnosis, it means hopefully our campaigns are working. Next slide, please, Maggie. To continue with the statistics of the helpline, COVID and vaccine-related queries constituted 15% of calls, but these are now receding for obvious reasons. A further 13% call us to discuss matters of the heart, the risk of the aorta expanding during pregnancy and labour, for example, as Mr. Rosendahl spoke of, the risk of endocarditis after dental treatment, the risk of myocarditis after the vaccine. Pectus, chest and scoliosis comprise 10% of calls, Many adults wonder if surgical intervention is possible at an adult age. Some experience scoliosis with kyphosis and it's inhibiting their breathing. It's very painful. Gastrointestinal problems have been discussed, sudden weight loss, sudden weight gain, and remaining calls are variously parents seeking advice on their children's condition, advice often on what to say when their child is the first member of the family to be diagnosed. The child's naturally frightened, they are too. Pain management is a popular question, particularly of dural ectasia, which of everything suffered in Marfan syndrome, many patients have said, it's apparently the most painful. Depression is also discussed, eyes, retinal detachment. Metatarsalgia and joint dislocation is a recurring worry for many patients, and some call us just simply to talk. We adapt these calls weekly into Dr. Child's hopefully helpful casebook. It comes out every Wednesday. Next slide, please, Maggie. But our helpline doesn't offer only advice, pamphlets and recommendations. We also orchestrate peer-to-peer support, which we spoke of at lunchtime. There's nothing like speaking to someone similarly situated. This initiative of ours is gathering momentum with more and more successful encounters. So we invite you to join the conversation as a mentor or a mentee. And I'm going to leave you with a quote from a parent speaking of her young daughter's conversation with another young girl, which was a mutually wonderful experience. Thank you very much.
Thank you very much for setting that up. I think we're all enjoying the fact that this new service is really, really useful. Are there any quick questions for Victoria about the helpline?
Actually, a lady has asked of dural ectasia, of pain management, and her word for word virtually echoes several other patients. They find it incredibly hard to manage.
Yes. Yes, I'd like to answer that. It's a very specialized topic. And I really think that any patient who is suffering or thinks they're suffering from dural ectasia should be referred to a neurosurgeon. Nobody else should touch their back, and nobody else really can interpret the x-rays and special studies to be sure that they have dural ectasia. It is present in 65% of people with Marfan, but very often it's completely asymptomatic. So you need to be referred to a very special center like Queen Square Nervous Disorders Hospital to get a neurosurgeon's opinion. And it can be treated with surgery if the outpouchings can be made smaller, just as the aorta expands, so the sleeve around the spinal cord expands. And this pressure of fluid can actually cause a lot of pain and distress. So do ask to be referred for a very specialist opinion.